nyenjikwa abemomba mbabu momo. Wow 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 wow. Tena tutmo esa. Tinda nini ubini na foto nini go nakwe. Ebu mende mo. Go kwe. Ebu magamo. Go nakwe. Ebu na wunje. Go kwe. Ebu nanjikwa. Ane mene go meye go nakwe kwe ye.
Well, good morning, Dr. TUFON ROLAND.
Good morning, Dr. Tata.
Yes. By the way, how are you doing this morning?
I'm doing great. We haven't had water for some past days now, and fortunately, we had water today.
I wanted us to talk a little bit about your department. I'm very happy about the progress that I've seen, the patients coming here, and that you're one of the best in MOMO, and that you are taking your work very seriously. On a scale of 1 to 10, how do you think this department is at this point? Overall rating?
I would say I'll give an 8.
Good. I think too that we are at that level, and that patients' review is very, very interesting and positive. This was one of the first department that wanted to be a specialty department in this hospital. So what do you think we need to do to upgrade for you to fully use your talents?
I would say we have already the basic equipment that we need to start in a community like setting like this. One thing we are trying to do is a lot of publicity, because when we come to a village, patients are really ignorant when it comes to the oral health, most especially their dental health. So when they come to the hospital, it's definitely already at the late stage. So we are trying to sensitize them to know that regularly checking on a dentist is a vital, I would say it's something that they need to do at least twice a year. Like in other developed countries, we are still developing. So to boost the center and the dental department in particular, we need more community awareness, and that's what we have been trying to do, doing outreaches and getting into communities and getting them to know more about their teeth. Yes. So I think we are more focused on publicity.
Yeah, I think since I came here, I've seen most of the people come here, they either said, well, they have a tooth problem, they have a toothache. Are there people who come here just for regular teeth cleaning?
Yes, those who have done it before, or those who had information, maybe from family members, or those who are well-to-do, because most people who come for cleaning are those who are well-to-do and are educated. Yes, but the uneducated ones really know nothing about a regular dental checkup or routine checkups. So they only come when they have a problem. But the ones that are already aware, they come because maybe I have spoken to them and told them, okay, you need to do this at least twice a year or once a year, depending on their condition. So they get to come. But some come because they have gotten information from other people. So,
I think the government needs to do a good job to sensitize the population that it is important for them to get a regular
dental check.
I think they do it twice a year or
Twice
so.
a year.
Twice a year. And I think if people know that cleaning their teeth is preventive for some of these diseases, I think it's going to be important. What do you think we can do to publicize? Because most of these things, if you leave to the government, sometimes they never occur. But we need to really educate. Do you think we should have like maybe once every 2 months, a seminar which you organize here to talk about patients, the need for them to take care or oral care. Do you think that will sensitize a lot of people?
Yes, it will go a long way to help with the sensitization, like we are already doing. I have a radio program like after every 2 weeks where I go to the radio station and I ensure that I pass out an information about the oral health to the population. For those who don't have radios, we were doing outreaches, going to each community around MOMO division and maybe those even close to Bamenda. And we sensitize them by first of all talking to them before getting into handling their oral issues. So it's something that we have been trying to do to upgrade and to get more people to know about the department and how it functions.
One of your patients the other day came here with teeth sensitivity and all that. I wonder if you can clarify the correlation between teeth sensitivity and diabetes.
Most diabetic patients present with symptoms like swelling at the level of the gum.
The gums swelling.
Weakening at the level of the interligament space, which, the ligaments hold the joint. They help to put the teeth in place because there is a bone structure which is around the mouth, which holds the teeth, and the gum which is around it. So if the gum is affected, all those processes will weaken the teeth. And when it weakens that link to the teeth, the part of the teeth is exposed, I would say, which is the cement, which is the cement. And when it's exposed, they get sensitivity from cold water and from maybe substances that they put into their mouth. And that's why when they come, they be like, when they take warm water, they don't feel pain, but when they take cold water,
they feel pain.
Yes, they feel pain.
So I think from what I gathered from previous discussion is to try to get the building that we are thinking of having there and have a bigger settings for you that looks a little bit kind of small in your place here. The other thing which I know last time when I came here, there was a dental x-ray. It looks like it got bad. Do you think you really need it now? Is it handicapping you from doing your job?
Yes, it's a handicap because since I came, I haven't used it. And sometimes when you prescribe it to a patient, for them to go to Bamenda, to go do a retroalveolar x-ray, it's very difficult due to the crisis we are in, and you might end up just doing the treatment like by yourself without getting to seek radiologic review,
right,
to know if you're placing the right diagnosis. So it's very important and we really need it.
So you rely mostly on clinical diagnosis,
yes, clinical diagnosis
without the medical,
without complementary,
medical portion of it. I think we should focus on getting the dental x-ray. We don't know when we're gonna start the building and complete, but I think to have dental x-ray will actually help you in your job. I know that you really need some assistance here, and given that the with the conflicts and the slowness, we're gonna take time to be able to get a permanent assistant rather than the temporary assistance that you're getting. I think people want services, but they don't really know that it costs just to get a permanent staff in place. I don't know if you have any suggestions for me as I leave back for the US about your needs, about what you think we should do. And given that you guys are in the leadership position, that you look at the overall hospital, so you can tell me exactly some of the things that, if you don't have it now, I think you can also send a letter proposing things that you think that we should do, that the patients need.
Yeah, as the first thing, as you said, is what you propose, getting because it's kind of choked up in here, so getting a better place where we can establish behind, because with the noise too from the from all these machines, patient might be sleeping there, maybe having a heart problem, and they get shocked when you put on the machine. You need to go inform them and all that. So getting a place for the basic equipment, I think we have basic equipment. For the consumables, we always buy, which we don't even really know if it's the best. So if once in a while you can send us consumables, it'll be very helpful.
Any last word for me?
I want to thank you so much for coming all the way to Cameroon and doing all this, because most people will just come and decide to stay going for sightseeing, but you came and dedicated really your time to see how this place functions and how we have been doing, asking personal questions which will help improve not just us but also the services for the people. So I'm grateful. I'm also grateful for the community which I find myself in. Living all the way from Yaoundé to come and serve the people in the midst of a crisis is not easy.
Yes.
And sometimes you have tempting to want to go back to where there's life. But we say, what is life without being human and giving back to humanity?
Yes.
So in this situation where people find it difficult to get a dentist or a doctor in a setting like this with the crisis, I came to serve the people, and I will say thank you to the community too, who have been responding positively. And I want to thank all the people who are going to maybe get into view this video and help donate what we might need for a betterment of not just the community, but the Cameroon, and maybe why not the world at large.
Yeah, I always use the quote that if you better the life of somebody, you better your own life, and you better the world.
Yes.
So that is how I look from my own little lens. What have I done to change the world? And the way you've changed the world is you've made it possible for somebody to breathe a little bit easier because you have lived. And that is your success. Thank you so much.
Thank you to Dr. Tata. It's a pleasure.
Yes.